we're gonna go ahead and begin your respiratory assessment. The first thing I'm gonna do is just take a general note of the patient's appearance right now. I'm looking for any signs of respiratory distress. I'm making sure that her respirations are symmetrical and even, they're unlabored. Looking for any discolorations like cyanosis or signs of hypoxia. I'm gonna go ahead and check her nails for signs of clubbing. I'm gonna go like that and see, okay. I'm looking for any tripoding, use of accessory muscles, retractions, any nasal flaring, anything like that, which I don't see any. I'm also gonna take note of her lateral AP diameter, which should be 2 to 1, and that looks good also, okay? I'm gonna go ahead and move on to the palpation. I'm just gonna palpate down your spine here, and you let me know if you feel any pain or tenderness, okay? Anything?
No.
Okay, and then I'm also gonna press deeper down here in the lower area, lumbar. Anything?
No.
Okay. The next thing I'm gonna go ahead and do is I'm going to check for tenderness and pain with the costal vertebral angle. So I'm just gonna go lightly tap. Any pain,
No.
tenderness? Let's reach down here. This is checking for pain in your kidneys. Any pain or tenderness?
No.
Okay. All right. The next thing I'm going to go ahead and do is check for excursion and make sure that it's symmetrical. So I'm going to go down here about the middle of the back, and I'm going to kind of pinch, and with my hands pointed towards your armpits, go ahead and take a deep breath. And I'm watching to see if my hands expand symmetrically, which they do. The next thing I'm going to go ahead and do is just palpate for fremitus. And I'm just gonna have you say 99 every time that I touch you. Okay, so I'm gonna use the sides of my hands and making sure that it's symmetric. So go ahead.
99, 99, 99.
Go ahead and lift up.
99,
And then I'm gonna come around to the front and do the same thing with the anterior lobes.
99, 99, 99,
And one more time, lower down here.
99.
Okay. I'm also taking note if there's any signs or any sensations of crepitus or grating as I'm doing that, which I don't feel anything. Everything is symmetrical. The next thing I'm going to go ahead and do is I'm going to listen. I'm going to listen to your posterior side, your sides, and your anterior. So go ahead and take a deep breath for me. And lift up. Again over here. Okay. Next we're going to go ahead and do just take a deep breath. And at this time, I'm also going to take note of her respiratory rate, you know, as I'm observing her respirations. So next, the last thing I have to do is do percussion. I should start off in the back here, and I'm just going to go ahead and tap, and you should hear like a resonance. Go ahead, lift up your arm. Okay. And then the same thing over here. And then again under him. And then that would be it for the respiratory system. So I'm going to have you come sit in this chair, and I'll have you put your feet up, just like that. Kind of lean down. So the first thing with the cardiovascular system I'm going to do is check for JVD. I'm going to inspect. So if you want to turn your head all the way that way, I'm looking in the neck here for any signs of pulsations, which I don't see anything, which is good. I'm also just noting coloration of her skin and this general area too. The next thing I'm going to go ahead and do is I'm going to palpate the carotid pulses one at a time. As I'm feeling for the amplitude, I'm feeling for the rhythm to make sure it's at a regular rhythm and rate. I'm going to go ahead and palpate the sternal borders. While I do this, I'm feeling for any thrills, like a cat's purring, any heaves or lifts or pulsations kind of pumping out at me. So I'm going to start here, the costal border with the aortic. I'm just kind of feeling the pulmonic, Erb's point, tricuspid, and then the mitral, which would be over here. And while I'm feeling over here, you should be able to feel a pulsation. Can you lean this way, like all the way?
This way?
Yeah, kind of like have your whole body over like that, yeah. And you should be able to feel a pulsation, which I do. Okay, go ahead. And there's also no heaves or lifts or anything like that present. The next thing I'm going to go ahead and do is I'm going to listen to the heart sounds, and I'm also going to check for bruise first in the carotid pulses. Okay, go ahead. Okay. So there's no bruise present. Next thing I'm going to do is auscultate heart sounds in the same places I just palpated, using both the diaphragm and the bell of my stethoscope. At this time, I'm also going to take note of the amplitude, of the rhythm. I'm also listening for S1 and S2 or any abnormal heart sounds, which would be like S3, S4, or murmurs. And I could take an apical pulse when I get to that point too. So I'm going to start with the diaphragm. And then I'll switch it. Okay. All right. So everything sounds good. All I hear is S1, S2. No abnormal heart sounds are heard at this time, so that's normal. The next thing I'm going to go ahead and do is we're going to move on to the peripheral vascular system, and that's going to consist of all your pulses and your extremities, okay? So the first thing I'm going to do is I'm just taking a note. I'm looking for any vascular changes, any varicose veins or anything kind of sticking out as I look through here, okay? I'm going to take note of the fingers again. I'm checking capillary refill in both sides. I'm looking at the nail changes. I'm also going to check the toes too. I'm looking at the nails, and I'm seeing if there's any hair on the toes, because that also means that there's good vascular flow to the extremities. I'm going to go ahead and palpate just the arms. I'm feeling for temperature, making sure that they're warm, making sure they're dry. I'm also going to check for pitting edema as I kind of palpate in the feet here. I'm also checking, is there any pain or tenderness down here, or warmth, because sometimes there could be DVTs in this area. The next thing I'm going to go ahead and do is I'm going to have you kind of lift up your shirt a little bit, And I'm looking for any type of pulsations in the abdomen because you have your abdominal aorta coming down through here. Sometimes you can see some pulsation, so I'm just looking and seeing if I can take note of anything like that, which I don't see anything. I'm also going to go ahead and palpate too to see if I can feel it. And as it kind of splits to go to the kidneys and then the femoral arteries. Okay. The next thing I'm going to go ahead and do is I'm going to palpate all the pulses. So I already did the carotid, but I'm going to go ahead and do your brachials. Again, I'm noting the rhythm, the amplitude, you know, if it's weak or if it's strong. I'll check the radial pulses. Those are good. I have to do the popliteal, so go ahead and just like that. I'm going to go ahead and cup around. Okay, that's good. Okay, we'll do post-tibial. And then the pedal pulses. Which those are all present in there. Okay. Let's see what else. I'm also going to, I think that's everything else. Are you having any issues? We're going to defer the breast exam in this assessment, but are you having any issues that you want addressed at this time? Okay. And that's going to go ahead and complete your peripheral vascular, respiratory, and cardiac assessment, okay?